So much. It's very heartwarming to hear from you, Deirdre. I was thinking as you were talking about, your slide. When I arrived to Canada 18 years ago, there wasn't such a organization like AIMGA to guide and help IMGs. Definitely, I try to make a list of, challenges when I arrived to Canada. And one of the very first note that I made was lack of access to reliable information. And that's what it seems that you guys are offering. Like, it seems like to be a centralized place that people can look and reliably know what's the pathway, what pathway they need to take. When I arrived to Canada, it was more word of mouth. It wasn't much of Google and internet, and it wasn't much of support available. I arrived to Ontario in Kitchener-Waterloo, and at the time, I think if you were in a bigger center like Toronto, Vancouver, Calgary, perhaps there were more organized sort of support in place. But in Kitchener-Waterloo, there weren't that many IMGs, and there weren't any organized or a centralized place to get support. I remember there was a place called Multicultural Center. There was a coordinator who wanted to arrange a study group, and there were a group of IMGs that would meet once a month or so to kind of know what are the material you need to study to get ready for the exams. There was a Toronto note, and there wasn't really much access to know what the exam is going to look like how you didn't mention the Medical Council of Canada evaluation exam. At that point, there was an evaluation exam before qualifying exam 1. I don't know if it is still in place or not, but that was more.
Yeah, they removed that, so so some people have done that, of course, but yeah, that's been removed now, as well as the QE2 exam.
Okay, yes. So at the time, there was 3 exams that we needed to take. The evaluation exam, QE1 and QE2. Evaluation exam was very similar to qualifying exam 1, but it was more basic science. And then qualifying exam, there was more clinical questionnaire, and qualifying exam 2, it was the like OSCE that we needed to take. And there wasn't really much of guidance of how to prepare for this exam. Where it seems like now, hopefully, people have a better idea how to prepare for this exam. I think that was a bit of a challenge. And of course, you are a physician, and you would be satisfied doing, work in medical field, and preferably as a physician. So that was a challenge to get ready for this exam. And I was fortunate that I got to Canada right after my medical school. I didn't work in Iran before coming to Canada. I didn't have any experience. And I didn't have any children to take care of, or it was me and my partner. And I was lucky to focus on just exam and figure out what I need to do to go through these exams. And I think the other piece was, so if you're coming as an international graduate who's a specialist, who had experience of working in your country of origin, you perhaps can qualify to go to Ready to Practice or some other pathway. But for somebody who doesn't have the experience and is not a specialized, CARMS was my only option. So, and then understandably, getting ready for this exam takes time. You mentioned they are quite pricey. As a newcomer, affording paying for $2,000, $1,500 for each exam is significant. And then getting ready for exam, not knowing how to get ready for exam, takes a bit of time. So, and then you will be out of practice, and that would be, and it won't be to your benefit when you're applying for CARMS and competing with other candidates. You need to have some clinical experience. And that was another challenge, to find somebody who is willing and able to let you in to even have an observership, you know, just, and I think I was one of the luckier one who, you know, landed in a place that I got to meet Dr. Arya Neal, and then he was willing and he was open and he was eager to support people, and he would let me into, you know, to go to his office and to be in clinic with him. And that was to my benefit in my resume when I'm applying for CARMS, that I have done this observership. I have been active in refugee clinic. I have contact with people, and that, I think that was the biggest support that I had in my application for CARMS, because if you are just sitting at home and getting ready for this exam, it's not going to be to your benefit. It was very heartwarming to hear from your data that 33% of IMGs who applied for CARMS got matched. That's a big number. That's a very good number. I don't think that was the number when I applied for the residency. You know, I think the Canadian system is very organized, and in terms of the medical system of it, and there are not that many universities, or that there's not that many spots even for medical student to, you know, to go to medical school. And then residency is fairly limited. The number of the seats are very limited. And as a result, even Canadian have a hard time, like undergrad Canadian, to get into medical school. Then what happens that the one who really want to get to medical school, they go to Ireland and they go to Caribbean and they go to other country to do their medical school. And then when it comes to CARMS, you are an IMG and somebody who was born in Canada and went to undergrad in Canada, speak the language, knows the culture, you're competing with them as an IMG. So you are an IMG and they are an IMG because they did their medical graduation outside the Canada. So I think that was one of the challenge, because there were lots of IMGs who were Canadian, and that was the group of people that you were competing for a spot for. I think one of the other thing that I experienced was having a permanent residency in Canada. That's a requirement for somebody who is applying for CARMS. When I came to Canada, I came with a visitor visa. I came with my partner. He had a grant to study at University of Waterloo. So he had a student visa and I had a work visa, and I had a visitor visa. So I applied for work visa after arriving, and after a year or so, I think we applied for permanent residency. But that take a while. It take a couple of years to get your permanent residency. And I remember in 2008, I passed all the exam and I was ready to apply for CARMS, but I wasn't able to apply for CARMS because I didn't have my permanent residency. So I needed to wait another year, and another year means being out of practice for another year. So that's not going to be to your benefit as an IMG. You want to be as current as possible. It's great to hear that people calling AIMGA before arriving to Canada. I think that is great. People prepare for this exam. People get ready for the English proficiency exam, and then they are not out of practice for too long. When they arrive to Canada, mind you, that apply for people who are coming as a new immigrant. That doesn't apply for somebody who is a refugee, who's, you know, running from danger coming to Canada. They can't really plan. Many of refugees didn't plan to be in Canada, but here they are. And I think it takes a while for them to figure out what to do. And it's great to hear that AIMGA is there, Pegasus is there to support people to figure out what's the next step.